Obesity is a significant public health issue that has risen to alarming levels globally. It is defined as having an excessive amount of body fat, typically measured by a body mass index, BMI, of 30 or higher. Obesity carries a wide range of health risks, which can have both short-term and long-term effects on an individual's physical, emotional, and social well-being. Cardiovascular disease. Obesity is a major risk factor for cardiovascular diseases, including heart disease and stroke. Excess body fat can lead to the accumulation of cholesterol and other fatty substances in the arteries, which can cause atherosclerosis, narrowing and hardening of the arteries. This restricts blood flow and increases the likelihood of heart attacks and strokes. Obesity is also associated with elevated blood pressure, hypertension, a condition that can further damage the heart and blood vessels, increasing the risk of heart disease. Type 2 diabetes. Obesity is one of the leading causes of type 2 diabetes, a chronic condition that affects the way the body processes blood sugar, glucose. When a person is obese, their body's cells become resistant to insulin, a hormone responsible for regulating blood sugar. This resistance leads to elevated blood sugar levels, which over time can result in diabetes. The combination of obesity and diabetes significantly increases the risk of developing other complications, such as kidney failure, nerve damage, and blindness. Respiratory issues. Obesity can have a negative impact on the respiratory system. Excess fat around the chest and abdomen can restrict lung expansion, making it harder to breathe. Conditions like sleep apnea, a disorder characterized by interrupted breathing during sleep, are common in individuals who are obese. Sleep apnea can result in chronic fatigue, hypertension, and increased risk of heart disease. Additionally, obesity can make asthma worse, as the extra weight can inflame the airways and trigger asthma attacks. Joint problems. Carrying excess weight places significant stress on the joints, especially those in the lower body like the knees, hips, and lower back. This can lead to osteoarthritis, a condition where the cartilage protecting the joints wears away, causing pain, swelling, and stiffness. Over time, joint problems can significantly impair mobility and quality of life. Obesity is also a risk factor for chronic pain conditions related to the musculoskeletal system. Certain cancers. Obesity has been linked to an increased risk of several types of cancer, including breast, colorectal, endometrial, esophageal, kidney, and liver cancer. The exact mechanisms are still being researched, but it is believed that excess fat tissue may release hormones, such as estrogen and insulin, that promote cancer cell growth. Chronic inflammation associated with obesity may also play a role in the development of tumors. Mental health issues. In addition to the physical risks, obesity can have a profound impact on mental health. Individuals who are obese may experience depression, anxiety, and low self-esteem, often due to social stigma and discrimination. The psychological burden of living with obesity can result in emotional distress, further contributing to unhealthy eating habits and lack of physical activity, which perpetuate the cycle of obesity. Liver disease, non-alcoholic fatty liver disease, NAFLD, is a condition where fat accumulates in the liver, not caused by alcohol consumption. This is more common in individuals with obesity and can progress to more severe liver conditions, such as cirrhosis and liver failure. NAFLD increases the risk of liver cancer and can significantly impact overall health. Conclusion: the risks associated with obesity are extensive, affecting nearly every system in the body. While obesity can be prevented and managed through lifestyle changes, including diet and exercise, its prevalence remains high due to sedentary behaviors, poor dietary choices, and societal factors. Early intervention and public health efforts focused on reducing obesity are critical to decreasing its associated health risks and improving quality of life for affected individuals.